This video will describe how to deal with your hypoglycemia. This video has been designed to help you understand what hypoglycemia is, recognize the symptoms of hypoglycemia, learn how to treat your hypoglycemia, and understand how to prevent hypoglycemia. Understanding hypoglycemia. Hypoglycemia, or low blood sugar, usually happens when your blood sugar falls below a normal level of 4 millimoles per liter. You may be at risk of hypoglycemia for one or more of these reasons. You have type 1 or type 2 diabetes. You take insulin injections. A side effect of taking insulin is that it can lower your blood sugar to levels below your normal. You take a medication that works to increase your body's own insulin levels. These medications are called sulfonylureas. Examples of sulfonylureas: diamacron, Amaryl, and diabeta. You have skipped a meal or a snack, or you have eaten less or no carbohydrate, and you took your insulin or the other medications listed above. You have been more physically active than usual without adjusting your medication or food intake. Being more physically active can include doing housework, gardening, running errands, etc. Some common signs and symptoms of hypoglycemia that you may experience include lightheadedness, dizziness or weakness, hunger, nausea, upset stomach, cold sweats, chills, or clamminess, changes in vision, mood swings, irritability or impatience, nervousness or anxiety, color draining from your skin or pallor, tingling skin or numbness in your lips, tongue, or cheeks, headaches, pounding heartbeat. Each person's signs and symptoms of low blood sugar are different. It is important that you learn your own reaction to low blood sugar. Treating hypoglycemia. The most important part of treating hypoglycemia is to recognize the symptoms early and treat them quickly to raise your blood sugar back to a safe level. If you think your blood sugar may be low, check it immediately with your glucometer. You may have low blood sugar without experiencing these common symptoms. Therefore, you should check your blood sugar levels routinely as recommended by your healthcare team. If your blood sugar is low, that is, less than 4 millimoles per liter, remember the rule of 15. Immediately eat 15 grams of fast-acting carbohydrates. Wait for 15 minutes before you check your blood sugar level again. Examples of 15 grams of carbohydrates are 4 glucose tablets, such as 4 Dex-4 tablets. These can be purchased at your local pharmacy. Glucose tablets are the best choice and will bring your blood sugar level up to normal levels the quickest. 15 ml or 1 tablespoon or 5 packets of table sugar dissolved in water. 3/4 of a cup or 6 ounces of juice or regular soft drink, but not diet soda. 6 lifesavers, where 1 lifesaver equals 2.5 grams of carbohydrates. 15 ml, which is 1 tablespoon of honey. If the above options are not available, you can also have 8 ounces of non-fat or 1% milk. After eating 15 grams of fast-acting carbohydrates, wait 15 minutes and check your blood sugar again. If your blood sugar level is still below 4 millimoles per liter, repeat the rule of 15 until your blood sugar is above 4 millimoles per liter. Do not eat anything else when you are treating your low blood sugar until it is above 4 millimoles per liter. Other foods may slow down the absorption of the fast-acting carbohydrate and worsen your hypoglycemia. If your blood sugar level is back to normal, which is above 4 millimoles per liter, and your next planned meal or snack is more than an hour away, have something to eat that includes 15 grams of carbohydrate and a source of protein. Some examples include 1 slice of bread with peanut butter or 6 soda crackers and cheese. Severe hypoglycemia. Severe hypoglycemia happens when your blood sugar goes so low that you are unable to treat it yourself. It is an emergency and can cause these signs and symptoms: blurred vision, drowsiness, coordination problems or clumsiness, difficulty concentrating, confusion, difficulty speaking, bizarre behavior, seizures, unconsciousness or passing out. The best way to treat severe hypoglycemia is with an injection of glucagon. Glucagon is a hormone that will increase the level of sugar in your blood. Speak with your doctor about whether you should buy a glucagon kit and how and when to use it. You must make sure that the people around you, for example, your friends, family members, and coworkers, know how to help you if you are too sick to treat your own hypoglycemia. If you are experiencing severe hypoglycemia and do not have glucagon, your friends and family should call 911. People around you should know that they should never inject insulin because this will lower your blood sugar even more. They should never put food or liquids in your mouth because you may choke. They should also never put their hands in your mouth because this can also make you choke. Preventing hypoglycemia. We will now discuss some things that you can do to prevent hypoglycemia. Missing or delaying meals can cause hypoglycemia. Eating less than usual, especially if you take insulin, can also cause hypoglycemia. Speak to your healthcare team about a pattern of eating that works for you. Your medication can be adjusted to your lifestyle. This will help keep your blood sugar steady and prevent a low. Exercise can lower your blood sugar. Speak to your doctor or healthcare team about how to prevent hypoglycemia caused by physical activity. Speak to your doctor to find out if you are taking medication that can cause hypoglycemia. Drinking alcohol without food can cause hypoglycemia. Do not drink alcohol on an empty stomach. If you do drink alcohol on an empty stomach, check your blood sugar level before you fall asleep. If you have more than 2 alcoholic drinks, check your blood sugar level during the night. Test your blood sugar frequently. This is even more important if you are at risk for hypoglycemia for one of the reasons discussed in this video. Also, check your blood sugar immediately if you are experiencing any symptoms. Carry a source of fast-acting carbohydrate with you at all times, especially if you are at risk of hypoglycemia. Keep track of any hypoglycemic episodes you experience. Make a note of the date, time, and event surrounding the hypoglycemic episode. You can review your notes with your healthcare team at each visit. Your physician can suggest ways to avoid low blood sugar in the future. We hope that this video has helped you understand more about hypoglycemia. In summary, hypoglycemia is low blood sugar. People may have different reactions to hypoglycemia. Some common reactions to hypoglycemia are feeling lightheaded, dizzy, hungry, or nauseous. You should check your blood sugar level if you think you have hypoglycemia. Hypoglycemia can be treated by following the rule of 15. If your blood sugar is low, take 15 grams of rapid-acting carbohydrates. One example of 15 grams of rapid-acting carbohydrates is 4 Dex-4 tablets. If your blood sugar is still below 4 millimoles per liter after 15 minutes, take another 15 grams of rapid-acting carbohydrates. Repeat until your blood sugar level is above 4 millimoles per liter. You can prevent hypoglycemia by speaking to your healthcare team about your diet, exercise, medication, and alcohol intake, checking your blood sugar level frequently, carrying 15 grams of rapid-acting carbohydrates with you at all times. Should you have more questions, please speak to your healthcare team.